Well, earlier in this newscast, we heard that the public donated thousands of N95 masks this weekend to Minnesota nurses. But is that enough? Earlier this morning, I spoke with emergency room nurse Emily Allen, who works at St. Joseph Hospital in St. Paul. And we're joined right now by Emily Allen, who is a nurse at St. Joseph's Hospital in St. Paul, also a member of the Minnesota Nurses Association. Emily, thank you so much for taking the time to be with us this morning.
Thanks for having me.
All right. Well, let me ask you, first of all, about you personally. How are you doing, Emily? And how's life on the job these days?
You know, personally, it's really difficult. I have 3 children that are all under 4. I also have a husband that's a first responder. He's a police officer. So, you know, I worry about him as well. And as far as work, I am worried for patients. I am worried for staff. I am one of the charge nurses on the intensive care unit. And a lot of times staff are coming to us for answers and looking to us that way. And I don't have the answers to everything.
Right.
And I just feel honestly terrible for everybody.
Well, listen, we are so grateful to all of you nurses, and we did a story earlier in our show about the nurses put out a call for masks, and 30,000 were donated. So
Wasn't that amazing?
I hope the nurses know how much we all appreciate what you're doing and the sacrifice you're making. Let me ask you, being the mom of 3 kids, how old are they?
My baby is 11 months.
Oh, my goodness.
And then my middle daughter, she is 3, and then my oldest son is 4. So,
wow,
yeah.
You are a busy person even without this. Let me ask you, the governor set up a child care system for those people, healthcare workers, first responders. Are you using that, or are you using others to help you?
First of all, I think that's awesome that they were able to help us in any way. But unfortunately, with the ages of my children,
right,
the programs that were being put out were for K through 5 only. So my parents, shout out to my mom and dad, they're amazing.
Yay, mom and dad.
Yes, have been able to help us and really help take care of the kids while we're both so busy and serving our community. That's what we signed up to do, and that's what we love to do.
Okay,
so.
Emily, do you have enough protective equipment? It sounds like you got a flood of masks. Do you have enough protective equipment?
No. We do not. It's great, and thank you so much to everybody in the community for helping out, but it is still just not enough. It's not just the masks. I've talked to a couple of other people. The N95 masks are something that we get specially fitted for and tested for, and there are a handful of people, me included, that they don't quite fit well for. So there's another apparatus called a PAPR that have removable shields that go over your face, and we're running out of those shields. For my entire hospital, we have 12 helmets to share among the entire hospital, which is not a lot. You know, I'm with the patients that can go into cardiac arrest, respiratory arrest, you know, things like that need to be on a ventilator. And when we have those emergent situations, it's not just like one person is in the room doing everything. There is several of us that need to be in the room to do it and complete it safely for the patient. And we're running out of gowns now. You know, they're asking us to conserve gloves. It's not just masks. And we are low and almost out of everything. We're being asked to keep any supplies that we use, put it in a paper bag, and bring it to every single shift we work and keep it with us.
And normally you would not reuse those kinds of supplies,
no.
and you're having to do that.
Right.
I can't, is there somebody who's helping you folks in some way? I mean, who's helping Emily? Because you're obviously doing 5 things at once, and we are so grateful for it, for you and all the nurses and all the healthcare staff.
You know, I think as nurses, a lot of us are leaning on each other. We're coming together. And as well, for me personally, and I think a lot of people, it's my family. My family is what recharges me every single day that I come home and I've had a bad day, or I've seen these patients that are scared or staff that are scared. That is my biggest support system. And also, you know, my faith. I look and pray every single day for everybody, and that's what's getting me through.
Well,
So,
Emily, you are an inspiration, and I hope your kids know someday what an amazing job you are doing. And your husband, where does your husband work? He's a police
he's a
officer?
North St. Paul police officer.
North St.
Yep.
Paul police officer, all the police officers, all the first responders, amazing. We're in this together, and we are with you, and we are praying for you, and we are so grateful for all that you do. And I know that everybody in the public is really hoping that they can do more, and if there is something more, let us know, because we will do it.
Yeah, the biggest thing that we're dealing with right now is they've dubbed Bethesda Hospital as a COVID hospital. And they've asked a lot of us nurses to volunteer to go work over there, which a lot of us are willing to do. But they cannot guarantee that they're going to have the proper protective equipment for us to use. And they are not willing to give us any type of hazard pay to go over and work directly with all of these patients that are positive. So I think a lot of us are concerned about that.
Well,
And
it sounds like there are a lot of issues that you all are dealing with. Emily, I don't mean to cut you off because we do have to go, but
No,
again,
no.
Thank you so much, and I'll follow up with the Minnesota
Please.
Nurses Association to make sure that we stay on top of the nurses and the healthcare workers, making sure that they have everything they possibly can.
Thank you so much.
Well, thank you.
Stay safe too.
You stay safe too, and to your husband and to your 3 kids, thank you.
Thank you. Have a good day.
Absolutely, take care.